Depression is an awful illness affecting about 7% of the European population, and it affects those individuals, but it also affects their families, and they can't study perhaps, they can't work normally, so it has an economic impact. So the scorecards are looking at 4 key domains, trying to look at what is being done well, what needs to be done, and what is in progress. And it's aimed at helping policymakers at regional, national government level with things they can do to improve the quality of care and support for every individual with depression.
10% of people in Germany suffer from depressive symptoms, from depressive episodes. One of the major weaknesses in our country is that there are no registries in Germany that systematically collect data on prevalence or on treatment of depression. This is really important to evaluate whether some treatment strategies are effective or not. In 2019, the Federal Ministry of Health commissioned a concept for a population-based mental health surveillance. And this data will support prevention of mental health illnesses and improvement of mental health services. One of the recommendations would be to scale up the comprehensive mental health surveillance. And especially important is to apply to children and young people, not only to adults. I also think that the federal and regional governments and sickness funds should really be encouraged to use data that will be collected for service planning, for the monitoring, and of course for improvements.